Hi guys.
Hello.
Welcome back to our channel. So today we're going to shake that big table and talk about vaginal infections or vaginitis. So vaginal infection or vaginitis is an inflammation of your vagina. This is like a situation where you start experiencing redness, pain, or itching in your vaginal area. This is actually what is involved in vaginal infection or vaginitis.
So now we will talk about the different types of vaginal infections or vaginitis. There are different causes of vaginal infection or vaginitis. Especially we have those that are caused by viruses, but we don't classify them as part of these vaginal infections. They are categorized as part of STDs. So when we're talking about sexually transmitted disease, we're going to mention those ones. The three main ones that are categorized as vaginal infections are the yeast infection, or as it is also known, Candida infection. It's caused by a fungus which is called Candida albicans. The second most common vaginal infection is Trichomonas infection. Trichomonas infection is caused by a bacteria which is called Trichomonas vaginalis. And the third one is the bacterial vaginosis, which has different causes, but the most common cause is the bacteria called Gadnerella vaginalis.
So we're going to talk about the causes of vaginal infections. There are lots of causes of these vaginal infections or vaginitis. The first one, which is the most frequent actually, are the infections, which she has already talked about, right? The second is irritation and allergies, like things like soap, detergent, vaginal douches can cause an irritation of that our vaginal area. Even medications that you introduce into that place could even cause allergies for us. Foreign objects like tampons, IUDs, vibrators even can cause irritation of our vaginal area, because that place is a very intimate and delicate area. So anything that is too harsh to it can cause an irritation or allergies. The third is hormonal imbalance. We know that when it comes to the female body, our hormonal balance is very important. If there's an imbalance in our hormone levels, it can cause a big problem for us. So when we have hormonal imbalance, like for example, when we have low estrogen, especially during periods before puberty and post-menopausal periods, we can actually be prone to getting vaginal infections. And when you have high estrogen levels, example during pregnancy, you are also very vulnerable to getting vaginal infections. The next is poor hygiene. Ladies, please, hygiene is very important when it comes to a lady. You have to keep that place intact. If things are funky around there, it could be because you're not taking care of that place properly. It could be because you're not cleaning it properly, right? So let's try to keep things in order there. Thank you. The next cause is lifestyle. Now, why do I say lifestyle? Those who have a high frequency of sexual intercourse have a high tendency of developing vaginal infections. So that's actually one risk factor for getting vaginal infections or vaginitis. Another cause is diseases, other diseases that can make us prone to developing these vaginal infections. Like for example, diseases that depress your immune system, like diabetes, HIV/AIDS, or even chemotherapy that cancer patients receive. This can reduce your immune system, and then maybe the bacteria that are normally located in your vaginal area can even become a problem. Even if on a normal day and with a well-functioning immune system, those bacteria are normal, but when your immune system gets depressed, these bacteria can become a problem for you, thereby causing vaginal infections or vaginitis. And then we have medications like some broad spectrum antibiotics like tetracycline. even have oral contraceptives that can cause vaginal infections for you.
So make we talk symptoms. Wetin be the things where you go see wey go make you say you need to talk to your doctor? Generally, the number one reason why women go to a doctor is because they have problems down there. So, like, believe it or not, vaginal infections are very, very frequent. The symptoms of this video actually is important both for our sisters, but it's also important for the men. So don't think that it's a woman thing, because if a woman has some certain vaginal infections, you as the man might have to take treatment with her.
Yeah.
So you need to know. If she doesn't know she's having something there, you can be the one to identify it for her and tell her, okay, girl, we need to go check ourselves and stuff like that. So first of all, let's start with Candida's albicans. Yeast infection. What is the number one symptom that we're going to see in yeast infection? We're going to see intense itching. Like the place they scratch you, they scratch you, they scratch you. Like it's really making life unbearable for you. That's how bad the itching is. Okay, so number one, you're going to be having serious itching. Like she said, it's going to be swollen, it's going to be red. Okay, it's going to be painful. You're going to be having what we call dysuria, which is painful urination. So when you are peeing, you're going to be having like some kind of pain. So apart from this one, you go also get what they call discharge. Discharge na some kind liquid or semi-solid flow where they come out from that area. Okay, so the discharge, when we go see for this yeast infection, it go be like dried milk. They come dey like small lumps wey go stick to the wall of your vagina. E no get bad smell, but the itching na im be like the main thing where you go take note say wetin you get na yeast infection. And it's also important for us to know that yeast or the candidas itself is normal in our vagina, but now when it can't grow past normal, when it don't too boku past the way it suppose dey before, now it go fit cause this infection. And if you be person where they get yeast infection every time, you suppose check yourself. If it be say you get diabetes, because diabetic patients, they mostly have repetition of this infection because of the high glucose in their urine that increases the growth of this yeast in the vagina. Now the second one are the Trichomonas infection. Now this infection too, you will get swelling, you will get that place go red, but it get bad smell. Sometimes if they smell like fish, but they smell bad. Now the discharge where you go see, it dey greenish, yellowish green. Okay, and you know they like the candida. The discharge is solid. But the discharge where you go see for Trichomonas now more liquid discharge. You know they like that solid one where we see for the other one. So this one, the discharge dey liquid and na yellowish green. While the other one where we just talk about the yeast infection now white, but it dey solid. So now the difference you go see. And that thing where you go see for this Trichomonas now, the wall of your vagina go come resemble strawberry. We know strawberry as a red can get small depressions, exactly how your vagina is going to look. If you look at your vagina, it's looking like strawberry, sister, go to the doctor. You have an infection. Okay, so basically this is what you are going to see in Trichomonas. Now in the Bacterial vaginalis infection, most people are asymptomatic, they don't have symptoms, but when they show symptoms, what you will see is that they have discharge that is kind of grayish looking. Okay, so there's grayish looking discharge and it smells like fish. So if your vagina is smelling like fish, go to the doctor. Something is wrong. Your vagina should not be smelling like fish. Fish is fish. Vagina is vagina. It cannot smell like fish. So if it's smelling like fish, you need to see your doctor. So basically this is how you can differentiate between the different types of vaginal infections that you have. It's actually simple to tell. And boyfriends, husbands, please pay attention to this symptom because it also increases with sexual intercourse. Sorry to say, your sperm is like a foreign body to our vagina, so we kind of react to it,
to all that.
So like every time you have sexual intercourse, the woman's chances of having vaginal infection increases. Okay, so this is where we're going to stop this video. So in the next episode, we're going to continue with the diagnosis, the treatment, and how we can prevent the vaginal infection.
Okay, so a quick notice for everyone. We're going to be doing a Q&A session where we're going to be answering every question that is being sent to us about medical stuff that we've talked about, or any other medical question that you have to ask us. Please do not hesitate to send it to us. So we're going to be answering your questions. Please do not hesitate to send us your questions. We're waiting and we're very much motivated to answer you guys.
And so how can you send us your questions? You can go to our YouTube channel. You can comment under any video of your choice. You can drop your questions there. We'll be always checking our comment section to see if we have any questions from you guys, or you could just follow us on Instagram at All Round Health Talk and drop your questions there. You can DM us with your questions too, and so in that video we'll be answering every question. We've been getting a lot of questions, so we figured that we should probably have a video where we answer questions of our viewers. So please, if you haven't sent any question, try to send it so we can answer you. Oh, sorry. Just send it. You know what we are saying?
Yeah.
Send it, please. We'll be so glad to answer your question.
Yeah.
So we just want to end by saying, sisters, down there is like a very special place and we really need to take care of it. So if you're a woman or you're a lady watching this video, please try to share it to other sisters. And even if you're a woman or a man watching it, share it to men too, because sometimes the men will be the one to notice it. Maybe during sex they begin to perceive certain kind of smell. They can be the one to call the woman's attention to it. So like, this video is really important. Like, the sex life is something that is important to human beings. I believe like this video is important for everybody. I beg, Mona watch am. I beg, make una watch am, make una share am, make una like am, make una subscribe. Mona share am for una Facebook, Instagram, wherever. Make we help ourselves, please. Okay, you don't have to be a doctor to save a life. You can save a life by sharing this video. Okay, so thank you for always watching, and thank you for always supporting us. Please don't miss our next video where we're going to continue with this very interesting topic.
Very huge table. So, bye.
See you next week. Bye.